Okay, so to assess the combined movements of the back, what we're looking for is we're trying to find your primary movement that's causing pain and then seeing if there's a secondary movement that makes it worse. To do that, then that can give us a really good idea of where we want to go and or what techniques we want to use to treat the back. So the way we do it is if you've got flexion, if we just bend forwards, so we know how to flex, then come back up, and we know how to extend, come back, and then you're going to bend left, side flex right. So we've got that right, I hope. Okay. So if we want to go and check combined movement, if the movement going backwards causes the most pain, we're going to call that our primary movement. So we want to see if anything changes if we side flex it. So the best way to do this is if you can, if I come around this side, what I'm going to do with my left knee is I'm going to block client's knee there. My next hand is just going to go up on their sternum. I'm going to get them to bend back. And then from there, if I want them to side flex, then I can guide them towards me, or I can guide them away. And then that puts that side flexion component in, and then come back up. If we want them to, if we want to do it from a flexion point of view, if you can just turn slightly to an angle, I stand hip to hip, because that can block the hip. Client bends forward. If I want them to glide towards me, I can just pull them that way. And then I can go side flex away and then come back up. So then that's how you can work out your combined moves for flexion extension. Side flexion, exactly the same principle. If you're going to you want to find the side flexion as your primary movement, what you can do is you can bend them in that primary movement, and then again, if they're going to go extension, just bend them back. And then if they're going to go into flexion, just bend to the right. You can come at the hip and bend them forwards, just to find out if you've got a combined hand.